So gonorrhea has been mutating, just like most bacteria do, for years. Because of antibiotic resistance, which started in Asia, it's been spreading, and now a strain of gonorrhea that is resistant to most of our usual medications that we use is going round. But it doesn't mean that if you have it, there's no treatment. We still have some drugs that we spare and keep, locked for very serious situations, and gonorrhea can be treated.
An estimated 1.1 million Kenyans fall into poverty each year. And that's because of healthcare costs. Would SHA, SHIF, UHC change that, or is there more? Or perhaps, what's the difference between a pharmacy with a Blue Cross and a Green Cross? What about cancer and the rising incidence amongst the youth? Is it just lifestyle changes, or is there more? Women's health, men's health, your children's health, the economy, this and more awaits you on Season 2 of Kenya's favorite health podcast. My name is Dr. Diana Wangari Gitau, and welcome to Season 2 of the One Health Lens podcast.
Hi, how are you? I hope you've been having a lovely week so far. My name is Cheryl Blessing, and welcome back to yet another episode of One Health Lens podcast explained. And we've been tackling some STIs, and today I want us to talk about one in particular that has been very prevalent. We've been talking about this, so I want us to focus on gonorrhea as well as chlamydia. So I want us to combine the two. And I'm here with Dr. Amanda Kenya.
Yeah.
Karibu.
Thank you. Thanks for having me.
You're welcome. It's always such a pleasure. We were just chatting and saying how it's wonderful to have these conversations. And you have been the expert on these matters.
Yeah.
You've been giving us some information that we probably didn't know about.
Right.
Yeah. And today I want us to talk about gonorrhea and chlamydia. Gonorrhea has been talked about a lot in the past few months and since last year, because there was a new strain that was discovered.
Yeah.
And then chlamydia is present, but we don't talk about it as much. So I want us to highlight the two. Could you probably just describe what gonorrhea is and what chlamydia is?
Right. So gonorrhea and chlamydia are both sexually transmitted infections, and they are both caused by bacteria. So gonorrhea is caused by a bacteria called Neisseria gonorrhea, and chlamydia is caused by a bacteria called Chlamydia trachomatis. And that's the hardest thing I'm going to say today. Everything else is going to be quite simple. So funny enough, chlamydia is actually much more common than gonorrhea. Yeah. So it's funny that gonorrhea is the one that's always getting this news because of the new strains and all that. But yeah, they're both very similar in terms of how you get the infection, how the infection affects you physically, and the implications for your future fertility and sexual health. And the symptom wise, they're also quite similar, and guess what, they also are very social with each other, so they like hanging out together. So when we find you have gonorrhea, whether or not you have chlamydia, we're going to treat you for chlamydia as well, and the other way around. We usually treat both at the same time.
Because they go hand in hand.
They do.
And why is that? Is it because they're in maybe the same school of bacteria or something?
Group of schools of STIs. They like the same kind of environment, and so if you practice certain sexual behaviors, you're likely to get both of them. And then having them, of course, puts you at risk of contracting other infections like HIV and HPV, which you've talked about before.
And what are some of the ways that you can contract this too? Because we know there are STIs, and of course the one way to get it is being just sexually active. But is there any other way? Can you contract it orally, or what other ways can you contract the two?
So any sexual activity that involves oral sex or vaginal or anal sex, you can contract these infections. Yeah.
And I'm wondering, can it be exchanged by kissing?
No. No. Unless you have, it might, if you have what we call oropharyngeal gonorrhea, which is not very common. Maybe in someone who has very low immunity. So maybe they got it through having oral sex, and now you're kissing them. If they have a very active infection with the sores in the mouth and discharge, then you might contract an infection, but that's quite rare.
It's a very rare thing, but it can happen.
It can happen, yeah.
And what are some of the symptoms? How can you tell if you have gonorrhea or if like chlamydia is in your system? How can you tell?
So first of all, most people with both gonorrhea and chlamydia are not going to have symptoms. Any symptom.
Yeah.
So most people with gonorrhea and chlamydia do not have symptoms. That means you can be out here having unprotected sex and spreading the infection without knowing that you have it, right? But those who have symptoms, more men would have symptoms compared to women.
Oh.
Yeah. And then of the men and women who have symptoms, let's talk about the men first. You might have a penile discharge, so some discharge coming out of where you pee. It can be pussy-like, like whitish yellow. It might have a bad smell, it might not. You might have pain when you pass urine. When you're not passing urine, you might still feel some pain and some itchiness and discomfort in your penis. You might rarely have a swelling of your scrotum, your testicles. And then this will come and it might even go away on its own, even without treatment, but you still remain with the infection.
Yeah.
For women, you might have vaginal discharge that, again, if you have gonorrhea, it's more pus-like, so it's yellowish white. It literally looks like pus. Chlamydia, you might have a bit of a more watery discharge that you might think is even normal.
Okay.
And then a woman can also have pain while passing urine. And then the thing about both of these infections is if a woman can also have a fever, and she can also have lower abdominal pain, which can go away on its own even without treatment.
Yeah.
So the thing about chlamydia and gonorrhea, for both men and women, it can affect your fertility in the future. So for men, it can cause the tube where you pass urine through, it gets inflamed and then it sticks together and causes what we call strictures, right? And also the tube that passes sperm from your testicles to where they need to come out of can be closed. That's called urethritis and epididymitis. This can cause you to not be able to have your sperms move through the pathway that they need to move, and that will cause infertility if your sperms are not able to come out.
Yeah.
For women, the infection can go into your pelvis. It can affect the lining of your uterus. It can affect your tubes. It can affect your ovaries. You can have abscesses in your pelvis, and your tubes can become all twisted up and malformed, and you can get blocked tubes, which is a very common cause of blocked tubes in our population. And we know when you have blocked tubes, you are infertile. Yeah.
And it's so fascinating. It's actually crazy when you're talking about that.
Yeah.
And these are just some instances. It doesn't always show in every single person who has the bacteria.
Yeah, for sure.
So what are the conditions that can create the symptoms to appear?
It's just person to person. There's nothing special about someone who has infertility because of chlamydia as compared to someone else. It's just, picking the short end of the stick. Yeah.
And I think maybe one thing we can also highlight is women often have discharge. It's a biological thing. It's natural. But you can differentiate by the color and the consistency.
Yes.
Is that what because you're talking about with gonorrhea, it's pus-like, and then with chlamydia, it's more watery.
A bit more watery.
Yeah.
Yeah, it can also be a little bit thick, but usually more on the watery side and quite profuse. But like we said, most people are not going to have any symptoms from both of these infections. So like we said, for syphilis, you just have to keep testing.
Yeah,
right?
to be sure. But hey, now I'm wondering, because there's also this new strain that came up, the super gonorrhea, and I think it came up because it's a bit more resistant to the drugs. Yeah. So it most likely it's there to stay. Once you contract it, it's there for life.
Not quite.
Yeah.
So This is not new, by the way. I believe a few years ago we had the same super gonorrhea. Now it's another super gonorrhea. So gonorrhea has been mutating, just like most bacteria do, for years. Because of antibiotic resistance, which started in Asia, it's been spreading, and now a strain of gonorrhea that is resistant to most of our usual medications that we use is going round. But it doesn't mean that if you have it, there's no treatment. We still have some drugs that we spare and keep, locked for very serious situations, and gonorrhea can be treated.
And I'm wondering what would make the strain resistant, because if it's a bacteria, so obviously it can be treated. Once it's discovered, you put on medication, and it's something that can be treated and cleared from your system. But is it because some instances individuals can contract it multiple times, and when they're on meds a few times, it makes it resistant? Or what makes the strain resistant?
So what makes it resistant is it's a global thing. It's not one person. So it's not resistant for you only. How it works is when we in the world are using antibiotics for flu, for anything you're taking antibiotics. That's why we as doctors keep saying, please don't take antibiotics for the flu. You're not just messing up your own body and resistance, but you're contributing to the general resistance of the bacteria in the world that are going around. And so that's what happens when people are just not being careful about how they're using antibiotics, misusing and abusing antibiotics. That's what leads to antibiotic resistance of different kinds of bacteria.
And it's fascinating when you say that, because I know there are people who are reliant on drugs. Every time they feel something, they want to take meds immediately, and that eventually makes the bacteria in our system and everything a bit more resistant.
Yeah, they're spoiling for the rest of us. We're trying to be careful.
But then what should people do? What can we do? Are there any ways that, okay, this is deviating a bit from from the gonorrhea and chlamydia, but just in terms of just ensuring that we can't even enhance the bacteria of other STIs and other diseases, what can we do when you're feeling unwell?
By feeling unwell, I assume you mean like a flu. First of all, trust your body. Your body actually has an immune system that is there to do its job, right? And most of the time, it's going to fight off whatever infection that is. If it's a virus especially. Antibiotics are not helping you whatsoever. Many people say, I was so unwell, but then as soon as I took antibiotics, I felt better. I assure you would have felt better with or without those antibiotics. It was purely a coincidence. So give the antibiotics a rest. Just leave them and trust your body to heal. There's so many home remedies. Let's go back also, to the past when we trusted our home remedies and we trusted our bodies.
And I think that's something important. As much as we've deviated a bit, that's something important that we can pick. And going back to gonorrhea and chlamydia, you've talked about it causing infertility. Is it because the symptoms become undetected for so long, or because the bacteria is undetected for so long, so it stays in your system for a while and eventually it causes harm? Is that the case?
That's how it works, right? Because obviously if someone had symptoms throughout, you definitely go to hospital and something would prompt you to get treatment, and then that would be the end of that story. But because it can be quite silent with no symptoms, no repercussions, you're just living your life, minding your own business, kumbe in the background your tubes are being messed up by an infection.
And do you not feel that? Is there no
Not
pain? Because
really.
I can imagine the way you feel cramps or something.
You can have pain, pelvic pain, chronic pelvic pain, but most people don't have any symptoms whatsoever.
And another thing that I found interesting when you're talking about the symptoms, particularly in the ladies, it can be confused or mistaken for UTIs, because UTIs come with the lower pain and you feel some discharge. So it's very easy to differentiate the two.
So you might go to a pharmacy and just get like a normal antibiotic and say,
over the
I have
counter.
a UTI. The pharmacist will give you the drugs, and then your symptoms will go away, but you haven't taken the correct antibiotics for gonorrhea or chlamydia, and therefore your infection is still there in the background doing what it does.
And how long can it last? How long can it stay with you, the bacteria?
For a really, really, really long time.
And can it be, because we were talking about syphilis, the different stages.
Yeah.
So the stages when you can pass it, and the stages when you can't pass it. It's just dormant in your body.
For gonorrhea and chlamydia, if you have the infection, you're passing it most of the time.
Throughout,
Yeah.
whether you have symptoms, whether you know
Yeah.
it, nothing. It's
Yeah.
just you passing it from one person to another. And why are they like very intertwined? Because we're talking about the fact that they like to hang around together.
Yeah.
They have similar symptoms as
Yeah.
well, and the effect and everything. I'm wondering, is there something, because you've talked about them thriving in the same conditions. What are these conditions that are favorable to these two bacteria?
Just the mucous membrane. So mucous membrane is like the inside of our bodies. So like the inside of your mouth has mucous membranes, the inside of your labia and your genitalia, the inside of your anus. That's the transition from your skin to the soft, wet part. That's the mucous membrane. That's the area they love to hang around. Yeah, they're just besties.
They're like bestie.
Yeah.
And it's so easy to contract one once you have the
Yeah,
other.
That's why we don't like wasting too many resources testing for all sorts of things. If we find one, we're treating you for the other.
Yeah.
And we're giving you a prescription for your partner or your partners, wherever they are.
Yeah. And can it be passed from mother to child?
Yes, it can. If you have an active infection, then and you're delivering, then your newborn can get gonorrhea and chlamydia. Yeah.
So it also just trickles back to getting tested. It just you just need to
Once
get
again.
tested. And that's the one thing I think is standing out in most of the STIs that we have. The need and the emphasis on getting regular testing.
Right. I think one of the things we've really brought out in our conversations is it's kind of hard to know if you have an STI.
Yeah.
Like, it's not as obvious as people would think. You
People
don't always have
yeah.
symptoms. You wouldn't always have a smelly discharge. You wouldn't always have an ulcer or a lesion or a pimple or a rash somewhere. Imagine most of the time you have no symptoms.
At all.
So we probably need to get tested more than we think, right?
That's true.
Yeah.
Because it's the most fascinating thing that I'm picking from that. Because you'd expect there to be some external signs,
Serious
like some
thing.
serious thing, like I'm
Yeah.
collapsing and
Yeah.
convulsing or something.
Yeah.
But it's just the bacteria that's in your system and you have no idea. You're just going about your day and,
Right.
you know,
Imagine.
does it cause anything aside from the infertility that it can cause? Does it cause anything else? Can it lead to maybe blindness? Can it cause cancer? Because we've talked about like HPV, there are certain types that cause cancer.
Right.
With syphilis, there's some that can cause even dementia long term.
Yeah.
Is there any other extreme implications of the bacteria?
Extreme implications will usually be on a newborn because of their very weak immune system. So you can find the mom has barely any symptoms. She delivers vaginally because the baby is passing through a passage that has these bacteria.
Yeah.
Baby will be infected, and now their mucous membranes are going to be infected, and it's usually the eyes first. So baby's eyes can be seriously infected if they are born to a mom with the infection.
Yeah.
But for an adult person, the prolonged complications are usually going to be fertility related. Yeah.
But then another thing that you mentioned from an earlier conversation we had was the fact that moms get tested. In the first term of pregnancy, they're usually tested for all STIs.
Not quite. Moms in the first trimester are usually tested for syphilis and HIV. If they have a high-risk lifestyle or if they are showing any symptoms, by a high-risk lifestyle, I mean if they're sex workers or if they have multiple sex partners or
Yeah.
if they say that their partner has multiple sex partners, maybe they're in a polygamous relationship, then we can test them for other things. But for the most part, because of funds, to be honest, we only test just a few. But it's definitely useful to test for all.
For everything.
Yeah.
So it's just upon you as an individual to just get tested.
Yeah.
And what happens if you have an active infection and you're just about to give birth? Is there an alternative that you can do?
Yeah, we can treat you. First of all, treatment is quite, it's quite easy to do. That's the thing. Once we discover you have the infection, the treatment is quite straightforward. And usually it's not going to be like you have 1 day to deliver and we found the infection. So we found it in good time and we're going to treat you and then it'll be fine for your delivery.
So you don't have to like opt for CS or some other?
No, not for gonorrhea and syphilis. It depends though. It really depends on if you have a really active infection or if it's a quiet infection. It truly depends on a case-by-case basis. So I don't want to give any blanket recommendations.
Okay, so it's just upon the individual again. You have to, it's about your system, it's about the stage that you're at, and even when you discovered it, because perhaps you don't have time for all these other things. And going back to the super gonorrhea aspect, because you mentioned, in my mind, you probably, and I think this cuts across for most people, they assume that super gonorrhea cannot be treated. Yeah.
No, it can be treated. It's just that the treatment will be a little bit more hardcore. The antibiotic you'll be given will most likely be given through the vein and not orally, because we're going to give an antibiotic that we reserve for very serious infections. But it can be treated. It's not the end of the world.
Yeah, and I think that probably just is shedding some light on some of it, because there was this talk about super gonorrhea and it was so mystified that most people did not understand, because now there is gonorrhea that people don't understand, and now there is super gonorrhea. It makes it even more scary. But we've talked about gonorrhea and chlamydia being very similar. They're both treatable. Once you discover it, you can get treated, and it's all dependent on you getting tested, because there are just a few rare cases that have external symptoms. But for the most part, it's very easy to go undetected for years and years and years. And maybe that's one thing that people should take note of, because there are so many people who have multiple sexual partners, move on from one person to the next, they don't get tested.
No testing, nothing.
And it's just, you see this thing of, I trust you, Kwani, you don't trust me. That's probably the downfall of our society, because we just need to have evidence, hardcore evidence, like, because
at this point it's not about trust, it's about taking care of yourself and also taking care of your partner, who I'm assuming you care about, right? So let's both get tested. Regardless of the results, we'll know how to deal with it under guidance of a professional, and it's going to be okay. But let's just know the way forward. Let's know our status.
Let's know our status. I think that's an amazing place to end it at, because now we've demystified gonorrhea and chlamydia. I think it's a bit more clearer, even to me, because in my head I had some assumptions and myths and misconceptions. But now that's clearer, and it's nice to know that it's something that can be treated. As much as the bacteria might be resistant and all these things, it's something that can be dealt with.
It is.
So I think that's a wonderful point to end this conversation at. If you have any questions, perhaps you can go on our socials and ask us that. We will respond to every single question that you have, and we will have another amazing conversation soon. Maybe not about STIs.
About something else.
We need to learn about something else. But it's been very fascinating. I think the one thing that we've been taking away from this conversation is get tested.
Please get tested.
Please.
For all STIs at least once a year, and every time you have a new sexual partner.
Just for your safety, because you love yourself and you love your partner, just ensure that you prioritize your health. So that's it for us for today, and I've had so much fun.
Thanks for having me.
It's always a pleasure.
So fun.
Dr. Kenya is the best, guys. Go and follow her on her socials as well. And we will see you next time.